Okay, perfect. So thanks so much everyone for being here and welcome to our final AKRI speaker series of 2024, Measuring and Addressing Recovery Capital with Dr. Elizabeth Bowen. We're so happy to have you here to kind of talk about recovery capital, kind of this intersection of public health measurement and the criminal justice system. We started this speaker series in 2020 to really just kind of have a venue for our treatment court staff to learn a little bit about the different challenges, issues, topics that would help us become better at serving our population of people involved in the criminal justice system. And so really want to thank you again for just taking the time to talk about this intersection, which I've gotten really curious about over the past year and really think our overall desires to bring more public health conversations and interventions into the justice system. So why don't we go ahead and just start off with having you talk a little bit about yourself and introduce your background and work that you do.
Sure. Thanks so much, Wyatt. I'm excited to be here, excited to be with you all. And as Wyatt said, thank you for making time for this, especially on a Friday afternoon. So a little bit about me. I'm an associate professor in the School of Social Work at the University at Buffalo. And before I went the research route, I was a practicing clinical social worker, mostly in the Chicago area. And my area was in homelessness, so helping people that were homeless who also often had a lot of substance use, mental health issues. And I know a lot also would fall into that reentry population. So many of the people that I worked with experiencing homelessness had been incarcerated at some point and often were in and out in that cycle of homelessness and incarceration. And I was working in housing first programs, so trying to help people transition from being homeless to getting housing as quickly as possible. And this is actually relevant to what we're talking about today, to recovery capital, because one thing that I remember thinking at the time, again, working with a lot of people who were homeless and struggling with substance use problems, is no, nobody wanted to continue to have an addiction. It was not fun. It was difficult in all kinds of ways for folks. And for the most part, people really wanted to heal, wanted to be in recovery, but they often struggled with it. And so, what I would hear from my clients at the time was they would say things like, I really want this, but I guess ultimately I'm just not motivated enough because if I was, I'd be able to succeed in my recovery. So I guess I don't want it bad enough yet. So that was the message that they were hearing, I think, from other people, maybe from treatment programs or other resources they had sought out, and they had internalized it and felt like it was their fault that they weren't succeeding in recovery. And something about that always rubbed me the wrong way a little bit because I thought it's not that they don't want it. Like to me, that seemed pretty clear. It was more that they were homeless, they had a lot of instability, didn't have good social support, just nothing in their lives was really set up to help them succeed in recovery. And so then later, when I went back to school and decided I wanted to get my PhD and become a researcher, I came across this idea of recovery capital and it clicked. And I thought, okay, that's what was going on. So it really helped me kind of shift my thinking from thinking about recovery as like a personal or motivational issue to looking more broadly at the resources that can help somebody recover. And I just think that shift is really important.
Yeah, absolutely. Kind of what you're describing, right? That internal motivation, that confidence, kind of all the soft skills that we're working on with people who have been involved in the justice system. It's really just having them look at themselves in the mirror in a little bit of a
Mhm.
different way. And we often approach it with I want to believe in you until you believe in yourself,
Yeah,
because so many of our clients have just come from such challenging backgrounds, right? Where
right.
the deck is stacked against them, just all these really traumatic experiences, and then just the lack of support, both systemically, individually, from their community, where we want to look at them in a broader way. And so maybe we can talk a little bit with a pretty popular public health term, right? The social determinants of health, where we want to think about kind of people as a whole. So, from the criminal justice perspective, right, this is often looked at as kind of wraparound services or kind of thinking about issues of people in their entirety. But from your expertise in kind of the public health realm, can you just talk a little bit about what the social determinants of health are and how we look at things from that lens?
Yeah, absolutely. I mean, this is really fundamental to the work that I do, just using that social determinants of health framework. And so for me, I think about it on, I guess, the most fundamental level is that I think before we started having these conversations about social determinants of health more commonly, I think a lot of people tended to think about health in more narrow terms. So to think like, well, germs cause, disease, or being around other people that are sick cause disease. And of course, that's true, but there's so many different social factors that play into no matter what health problem we're talking about, whether it's addiction or cancer or something else. It's never just those biological factors. It's also the social factors. And I, can always think of tons of examples of this from my background that I just discussed, working with people experiencing homelessness. So think about housing just as one example of a huge social determinant of health. You can, of course, be healthy without stable housing, but it's really hard. And just, think off the top of your head of all the different ways that housing is important to health. It provides you with a warm place to sleep at night. It provides you with protection against the elements. It provides a sense of privacy and a certain sense of security, I think, to have stable housing. It provides you with a place to prepare food. So if you don't have stable housing, it's hard to eat in a healthy way or get enough to eat. It's hard to be able to store and properly take any medications you might need to take without stable housing. It exposes somebody potentially to a lot of violence and a lot of traumatic encounters if they don't have that. So housing is one example, I think, of a huge social determinant of health. But of course, it's not just that. It's other things too. Like we can look at not just the housing level, but the neighborhood level. So does somebody live in a neighborhood where they feel safe, where they have parks and places they can exercise and get healthy food? Or do they live in a neighborhood where they don't have those things and maybe they feel like they have to stay inside all the time because it isn't safe or doesn't feel safe? We can look at employment, we can look at education, just income, so many different things. But I think it's really fundamentally important.
Absolutely, right. And it's kind of the broader effect where there's nothing that doesn't affect the social determinants of health, right?
Yeah.
Everything is related and has an influence. And so we think about access, right? Where if you've never had health insurance before, even just
Right.
utilizing and accessing healthcare is a very big deal. Being preventative in your healthcare as opposed to reactive, and not paying $1,000 for emergency room visits and just going to get your free physical every year is a really different way to look at things. And so we see this so much more, especially with our clients in the justice system, where typically a lot of their experience with healthcare is through prison healthcare, right?
Yeah.
And it's forced, it's very minimal, it's very difficult to maintain medication and things like that. And so having that as an aspect of something that we're thinking about as staff, where it's not just kind of the instant issue in front of us, right? It's thinking through their experience, their environment, and all these determinants to kind of help us frame how we interact and work with people. So just want to take a quick pause and just welcome the audience to type in any questions in the chat throughout our conversation while we'll weave everything in and kind of just make sure that we're engaging in answering any questions that come up. And I think now would be a great time to just move into talking about what recovery capital is. And so I want to just give a quick shout out to my former MPH intern, Michaela Aubrey, who was incredible in doing all this research about what recovery capital is, and really designating your assessment, which we'll talk about in a little bit, into our organization. But I just want to give her a shout out for finding the assessment, finding you, and having this opportunity to talk to you about what recovery capital is. So if you could just maybe start off with a broad definition of what recovery capital is and how it's defined.
Sure. And I think this flows really well from what we just talked about with the social determinants of health. So I think you'll see a lot of overlap between those two concepts. So recovery capital, this is not my idea, but this was something that two researchers came up with about 20 years ago or so. So the idea has been around for a while. And if you don't mind, Wyatt, I'll give just a little background first on how they got to this idea of recovery capital, because I think that part is interesting too.
Yeah.
So the two researchers, it was someone named Robert Granfield, who I've been able to collaborate with now. He's at my university just by happenstance, and William Cloud is the other researcher. So Cloud and Granfield set out, again, more than 20 years ago at this point, to study something called unassisted recovery. So people who recover from a substance use problem without going to treatment, without using even 12-step groups, people who just do this on their own, which is actually more people than you might imagine. And so that was known that that was the phenomenon, but there wasn't much research on it. They just wanted to talk to people that met that definition of recovering without treatment and ask them how they did it. So what strategies did they use? And so they interviewed a bunch of these people And what they heard was people said things like, they had really good networks of friends and family, which could include other people in recovery, but also just other people in their lives that supported them in recovery. Some people talked about having a passion, like a hobby, or being able to really throw themselves into their work, and that was what helped them to recover. Some people talked about, reading and learning about addiction and using their education and their intellect to understand their addiction, and that proved to be important. For some people, it was religion and spirituality. For some people, they had to actually leave where they were living and kind of make a fresh start. Some people talked about physical exercise, that just getting into a routine with that made a huge difference in their recovery. So they heard this range of strategies. And based on that, Cloud and Granfield reflected and put it together and came up with this idea of recovery capital. And so what it is basically just a holistic way of looking at the different resources, which can be internal to a person or external, that facilitate their recovery. And so they came up with 4 categories. So I'll try not to bore people with too much detail, but I will walk you through those 4 categories because I think that's important too. So the first one is social capital. So that's social support, that's your friends and family. Again, could be people in recovery, but it could be just friends. Maybe they don't have a substance use problem, but they support you in your recovery, and they're there for you. They understand what's going on. So that's one category, social capital. Another category is physical capital. So these are the tangible things, the stuff I was talking about, like housing, income, transportation, having a job, just those basic resources that make it, it's a lot harder recovery without those, I guess, is one way to think about it. And then the third category is human capital. So these are things that are internal to a person. And this can be everything from spirituality to, just having a positive attitude, to having certain skills or an education or a disposition. Your health would fall under this. Those type of qualities is human capital. And then the last one is cultural or community capital. So this is looking beyond a person to their larger culture or community to see what is there that they can tap into that would support their recovery. So are there resources in their community or in their neighborhood that support recovery? Are there aspects of whatever their culture is or however they define it? Are there parts of their culture or their identity that they can participate in that they feel resonate or support them as a person in recovery? So those are the 4 categories. And one other thing I should maybe mention is Cloud and Granfield also specified that we could think about those things as positive or as the negative version. So I was describing it in terms of positives, but think about social capital, for example. So having friends that support you in recovery, that's positive social capital. But it's also possible somebody could have a lot of people in their social circle, let's say, that are still struggling with addiction, still actively using. That would be negative social capital. And so Cloud and Granfield conceptualized it that we should really look at both. We want to be strengths based and look at those supports, positive recovery capital, but it's also important to maybe check in with people about what negative capital they might have in those 4 categories and be able to help people address that too. So that's recovery capital in a nutshell.
Great. Thanks so much for sharing that. I think it leads to so many other questions and kind of just
Yeah.
having to think about clients in such a large viewpoint. And just kind of off the top of my head, we think about recovery, or at least I do in a lot of ways as well, just sobriety when it comes to substance use. Does recovery capital also apply to things like behavior change, mental health, physical health, or are we thinking only of recovery capital as a way of addressing someone's sobriety from drugs and alcohol?
Why, great question. I think it can be very broad. And actually, I do see, because I keep an eye on this as a researcher, I'm always kind of looking at how other people are using this term recovery capital and looking at different studies coming out about it. And increasingly, I do see the concept, same thing that I just described, applied not just with substance use addiction, but applied to things like mental health recovery, or even, I believe, I can't think of the article off the top of my head, but I think I have seen some things applying recovery capital to talking about the process of reentry, of transition from incarceration. So I think it is broadly applicable. And one other thing I'll throw out there, and I don't know, in this context with reentry, I know there's a lot of legal stipulations, so I don't know exactly how this fits in. But I think increasingly a lot of researchers in the addiction field, including me, are interested in looking at recovery pretty broadly, and it might not always be the same thing as what people think of as sobriety. So traditionally, people, I think, always assumed that being totally abstinent from any substance, that was kind of the definition of recovery. And it's not just researchers. A lot of people in practice too are increasingly looking at that more broadly.
Yeah.
So to include the possibility that some people might use a substance moderately, but still succeed in their recovery goals, and also looking maybe not just at that part, but regardless, I guess, of abstinence or moderate use, how else is a person doing? What's their quality of life? What's their well-being? And looking at measuring those things as well.
Yeah, absolutely. And so that's a great tie-in where in our district, right, we started off primarily as a drug court program, right? We're going to be addressing your sobriety and really get you into treatment and support that you need to address your drug and alcohol use. Um, Quickly, we found that the work was not only just drugs and alcohol, but the people, places, and things that
Yep.
someone was hanging out, right? And from that, it's really built into how we approach different populations, the needs of different people. So, for example, I want to also give a special thank you to our U.S. attorney who just launched their Veterans Track program in our district, where we now have a program designed to help veterans and the specific needs for veterans. We also have a young adult program where it's designed for the needs of 18 to 26-year-olds. And so drug use or kind of anything that is the traditional sense of recovery is often a baseline, right? But it's much more
Mhm.
complex than that. And it gets especially challenging when we think about some of the therapeutic components like criminal thinking errors, behavioral health challenges, even just the confidence and trust in large systems to be able to access things, right? No one likes going to the DMV or finding out or filing for a healthcare appointment, right? But kind of
Mhm.
having the skill and ability to understand how someone approaches these problems is something that we're regularly working on in the treatment courts. And so with Recovery Capital, where our interest and kind of research brought us to is that All Rise came out with the second edition of their best practices, and they recommended really looking into recovery capital as assessments
Mm.
in addition to a lot of the data that we keep. So with drug courts, right, we have a baseline measurement of substance use, right? We have UA tests. We get to measure how long someone's been sober, and it's a great starting point. It's much harder to measure how someone is doing in therapy, how they're doing in the community. We can measure things like how much money they've earned legally based on their pay stubs that they submit. Um, but we also can't, it's much more challenging to measure how confident they are with their money or how they're addressing their debts and things like that. So when this idea of recovery capital that encompasses everyone, which is what we're really trying to do in these treatment courts came about, it was trying to think of ways bigger to not only look at kind of outcomes, but earlier on while people are in our programs, is if there were specific places that we could find an intervention to help someone. And so that's a big reason about why we wanted to find the right recovery capital assessment to implement. And that kind of led us to the assessment that you've worked on very hard. So the multidimensional inventory of recovery capital, which perfectly matches our very long names of programs to our conviction alternatives programs of the Northern District of California. Um, and so would love to just hear about, your work with the MIRC assessment. We'll call it MIRC for short.
Yeah, I call it the MIRC for short. So add another acronym to the acronym soup that we all swim in.
We all don't have enough acronyms, right? We need more of them. So if you could tell us just a little bit about MIRC and, we'll kind of flesh out the reasoning and everything behind it, but tell us a little bit about the MIRC assessment.
Yeah, I'd be happy to. And I'm going to put a link in the chat, which will take you to just kind of a basic web page that my university hosts that talks a little bit about this tool, and you can download a PDF of it there, and talks a little bit about the background on it too. So that's good further information on it. And let me know if people can't access that, but hopefully you can. I just put it in the chat. So as I got interested in this topic of recovery capital as a researcher, of course, one direction that my mind went in was like, great, if we're going to talk about recovery capital, we're going to need a good way to measure it. And I am by far not the first person to bring that up. So there are already many other measures of recovery capital. And like anything, different ones are going to have their pros and cons. So I'm certainly not here to say that like mine is the best one by any means. But I did find as I looked at some of the existing ones before I developed this, some of them did have, in my opinion, some shortcomings. So they didn't always line up with those four categories of recovery capital that I talked about. Some of them included things that to me didn't really fit well with this concept or theory of recovery capital. And I also paid attention to who was in the sample of people that were used in developing those measures. And some I thought had some shortcomings there too. So sometimes when you do a deep dive and you read the articles about how the measures were developed, for several of them, it would be a primarily white population of people. It sometimes would be mostly high or middle income people. And it often would be people who are in treatment or in 12-step groups, because those are sometimes used as the way of recruiting people for research. So again, there's some ways in which that's okay, but in other ways that does not reflect the diversity in terms of race, gender, income, recovery pathway of the larger group of people that are in recovery. So my goal was to make a measure, and I should also add some measures are not free to use either. So my goal was to make something that would be inclusive, that would apply and resonate with the diverse pool of people in recovery, and that would be free for anybody to use, and that would line up with those four categories of recovery capital, and that would include positive and negative capital so that you can look at both strengths and potential areas of concern for somebody. So that's the background. And then I was fortunate to get funding. It was from NIAAA, which is the National Institute on Alcohol Abuse and Alcoholism. And because our funding was from that organization, which is alcohol focused, I do want to say that our eligibility criteria for my study developing this measure was people who identified as having resolved a prior problem with alcohol, which could be alcohol alone. In many cases, it was alcohol and other substances. But I say that just as a caveat because that is a limitation on this, that I can't say, for sure, people that have an addiction history that doesn't include alcohol, would this apply to them? I think it would. None of the items on the measure specifically referenced alcohol or any other substance, but that's just to be upfront about that. Yeah.
Yeah, that's great. Thanks so much for sharing all that. And
Yeah.
I think it lends more to kind of this newer way that the justice system is working, where there are actually a lot of therapeutic assessments that are involved now.
Mm.
So having the ACEs test, really understanding childhood trauma helps determine what type of therapy we refer people into. We have case management assessments to try to identify needs where we're going to be focusing on while they're working with us for the 12 to 18 months of the collaborative court. Um, One thing that, we had to keep in mind, and this was completely different thinking from someone who provides direct services to kind of more of an academic level, is thinking about things like overassessment, right? And
Mhm.
kind of
For sure.
survey fatigue and how involved someone would want to be. And so legally, right, there's a lot of surveys and plea agreements and things to
I
read.
bet. Yeah.
Where just getting into the program takes a long time and people need to be very thorough to understand the needs. But in looking at a lot of assessments, right, it was weighing a lot of that, right? So small things like phrasing, what was required with our population in particular, right? Asking directly if you have a mental health issue or a mental illness can be read as offensive, right? And kind of
Yeah.
shut down someone from even participating in the survey. So really keeping in mind how to develop a good screening tool, a good assessment to implement that's going to give us useful data to collect while we're working with someone who is going through recovery and working on their place in the community. And so, can you tell me just like a little bit about the timeline and kind of the collaboration with your team about developing the MIRC assessment?
Yes, this is, I mean, something I enjoy talking about it. What's kind of a labor of love to develop this. So in short, the process to develop it was first to make sure it really was grounded in the perspectives of people in recovery. And again, I want to stress it's not perfect, but I wanted to get a diverse group of people in recovery to weigh in on this and to tell me, you know, exactly like Wyatt said, like, give me opinions on ask about this, don't ask about this, ask a question this way, here's what's missing. Because it really shouldn't be just me as a researcher or my research colleagues determining that. Ultimately, this measure is for people in recovery. So I see that as one of the most important steps. So that's what we did as a first step was doing some interviews with a broad group of people in recovery, again, diverse with regard to race, gender, age, people's recovery pathway. We did actually ask about prior incarceration, so I do have data on that, but I'd have to look it up. I don't remember offhand what percentage of people had an incarceration history in our sample, but I would say it was, I mean, it's not a small percentage because we do know there's a lot of overlap, and I do recall that was the case, but I don't remember exactly. But in any case, that was the first step, was doing what I think of as qualitative vetting of the different items that I was considering including on this measure. So we got tons of great feedback that way. I think I started with like 100 items at the beginning, knowing we were not, like you just said, survey fatigue is a very real thing. So I knew I wasn't going to end up with a final measure with 100 items, but I wanted to start big and then kind of winnow it down. So we were able to cut it down quite a bit, just with great feedback from those interviews. And also we added some new things. We changed the phrasing. It was really helpful. And then once I had a decent first draft, but it was still pretty long, I think it was 48 items at that point, we did some psychometric pilot testing. So getting a big survey, it was close to 500 people across the country. Same thing, so still a very diverse sample, different recovery pathways, and having people fill out that survey and then working with, I'm not, a statistical genius, but I have really good stats people on my team who could work with me on that and crunch the numbers and figure out of those 48 items, which are performing well, which are not so useful, and what are the the emerging properties of this measure. So based on that, again, it was good feedback, good data. We were able to cut things down further and then do an almost final version in a new sample of, it was like 480 people, so close to 500 from all across the country. And again, get some more data on how people answered, which items perform well from a statistical viewpoint. We cut a few more items after that, and that all leads us to our final version of this instrument, which is 28 items. And Wyatt, I don't know how much time we have, but I can share my screen quickly if we want to take a look at it. It's up to you.
Sure. Well, we have about 15 minutes left, so I
Yeah,
think we have
got
enough
it.
time for just a short look at kind of what the questions look
Yeah.
like, how they're measured.
Okay. Should I share it then?
Yeah,
Yeah.
that'd be great.
All right. Can people see this? Yeah. The instrument? Yeah.
Yep.
Okay, so this is just the PDF version that's available on that website that I shared. So just to show you, how it's administered and what the questions are. So it's 4 subscales for those 4 categories: social, physical, human, and cultural. And then you can add them all up and get a total score. So just to look at a couple items, for example, they're all rated on a scale of 1 to 4, struggling, disagree to agree. And I do want to just point out the instructions at the beginning, which I think is important to just remind people this is not a judgment on anybody in their recovery. This is really just meant for somebody to reflect on how they feel, right now. And so some of the items under social capital are things like I actively support others who are in recovery. My family makes my recovery more difficult. I have at least one friend who supports my recovery, and so on. So they are pretty short and simple. Most people can fill this out and take it pretty quickly. You can ask somebody the questions or they could read it themselves. Maybe the only, I think, kind of tricky thing that I caution about is that because some items are positive, so they're good things, and some of them are negative. So having your family make your recovery more difficult, that's obviously negative recovery capital. So you have to flip, you have to reverse score them to get the total score. And when you do that, that means that a higher score total is better, means more recovery capital. And this ranges from 28 to 112. I'll stop sharing here. So 28 would be like the lowest possible recovery capital, and 112 would be the highest.
Great. Yeah, so that gives a good leeway into kind of talking about how we're trying to implement MIRC into our database
Yes.
and working with our clients. And kind of that flip led to a little bit of a challenge about how to capture the score in our database. But what we loved about it is that it gives a very simple number that we can measure periodically. And so
Mhm.
our hope moving forward as we implement MIRC and just to our initial assessment with our organization is having it kind of be sent out every 90 days or so, just to kind of see where a person is right now, and having just kind of regular data where, again, no judgment, right? It's just kind of a number that helps us evaluate. And within each bucket of capital, we kind of have this idea about where things may be slipping and going in. What I love about it just being a simple number, right? It also gives us a little bit of creativity about how to display this number, right? And so what we found is that clients are really curious to know about how they scored, and they want to know if there's any difference or kind of where things might have
Yeah.
changed over the past couple of months. So that's really important and interesting, just to be able to track your progress, right? Because we have all these kind of anecdotal stories, these qualitative components where, yes, we can measure sobriety, right? But I don't want to diminish, staying sober for 90 days. It's super important. But it's also just a number, and people can get coins from their meetings and these certificates from our programs, but kind of the overall picture of where someone is in the community is something really important for us to begin looking at. So we want to kind of get out ahead of having recovery capital as a data point in our treatment courts because, like I said, we're doing our best to follow best practices, really move into evidence-based approaches to evaluate how we're doing as programs in the larger criminal justice system. And we can't really talk about that unless we talk about recidivism.
Yeah.
And so traditionally in the justice system, recidivism rates have long been the measurement of success
Mhm.
for programs and interventions, and they are an extremely important data point, right? We need to know, and it's important to know whether people are still committing crimes or violating conditions or bringing challenges to public safety. However, it's one of the few points of data that is a negative measurement, right? And we're not really measuring any successes with recidivism rates. And so trying to find a way to kind of capture the whole of someone where going back to the social determinants of health and where people come from in their lives, right? Two things can exist, right? Someone can really be working hard on themselves to improve what they're doing. They can also violate a crime and have to
Yeah.
be put back in custody. And so, really figuring out how those two things live in the same space and coexist, and how we're measuring success is my hope of how we implement recovery capital as a measurement and look at things more productively. So, I'll kind of throw the question back your way, where as you develop this assessment, what did you kind of think you wanted people to measure as through for success, right? Like, what did you want people to get out of using the MIRC in their programs or within the court system?
Yeah, thanks for asking that. And that's what you described, I think, is exactly how I hope that different people would be using this. I mean, for research, but also just in practice for the purposes that you mentioned. And I guess I think about it on two levels. And one is that it would, make me happy if people use this, if they're in a role where they work individually with clients, and I picture myself, as a social worker working with my former clients to potentially give people this instrument and use it as a conversation point primarily. And so to give it to people at different time points, use it as a way of checking in with folks about like, okay, let's just see where you're at with your recovery capital at the beginning, maybe 90 days later, at the end of maybe whatever program they might be transitioning from, and use it to check in with them so that they can see their strengths that they may not realize and feel good about that. And then also see the areas, where they're lower and where maybe they can use some help and use that depending on the context. To refer people to housing and employment if that's the area, to talk with people about how they can change their social circle if maybe that's the area that they need, and so on. So that's what I would hope at an individual level. And then more at a programmatic level, I think this is what you're talking about too. I think it'd be really just exciting to have another data point in addition, say, to abstinence or recidivism or other things that are often measured, to be able to look across a population and say, maybe people come in with different levels of recovery capital, but while they're in our program, we can see that most people improve. And that's, something really, I think, important. So that's the direction I hope people go with it. And I will put one other thing in the chat here. I think I can post a PDF in there, and this is doing a deep, scientific researchy dive. But one of my colleagues, Kyler Knapp at University of Buffalo, recently published something where they looked at recovery capital. It's not with my measure, it's with a different one, for people in traditional drug courts and in opioid specific treatment courts. And they looked at what's that associated with. So not only what happens to recovery capital over time, which what they found is it, does tend to waver, go up and down quite a bit, but also what else is that linked to? And they did find that the more recovery capital people had, the less substances they were using or were likely to use. And that's exactly what I would hope. And I do hope we see more research like that that shows us what else recovery capital might link to. And since that might be of interest, given this topic and population, I will see if I can put that PDF in the chat here.
Yeah, that'd be great. And I mean, I think it just goes to cover that, even when we're talking about substance use and things and sobriety, right? It's inevitable that we're talking about family relationships
Right.
and community relationships. And All Rise regularly says like, oh, how many of you work in family court? And not everyone raises their hand. Drug courts are the most common and reentry courts are the most established. But they say everyone raise your hand because if you're dealing
Mm.
with this
Yeah.
population, you are absolutely dealing with people's families as well. And
Right.
so trying to just find different ways of being able to find and establish measurements in addition to like the cost savings. So one thing we look at, is how much money are we saving by this person not being in custody, right? It's very expensive to incarcerate someone. Is there a way to measure the likeliness of violations? Are they more, or even a reduction in symptoms, right? So with the mental health clients, for example, right? Just getting to medication monitoring is a really important key, and medication compliance is really important. And so finding ways to maybe not end all of the challenges, right? But getting to a better place where there's comfort, confidence, knowledge about a person as a whole is, I think, the ultimate goal of where we want to take these programs that are having these very specialized interventions in the justice system. But we can't just have they're doing good and it feels so good that they're
Yeah.
sober. We need to be able to talk about it from a data perspective and be able to present
Right.
why things are changing.
I really think that's important too. And I also, both in research and in practice and in systems, including treatment courts, it just think it's important to think about it in more nuanced terms beyond black and white. And traditionally, that's, I think, been part of the problem is we do think about these things so much as success or failure. You're clean or dirty in terms of your urine test. You're sober or you're not.
Yeah,
You are committing a recidivism or you're not. And those are very binary things when I think what we're really talking about is people that are complex and reflect a lot more nuances in how well they're doing or how well they're not doing. But we do have different tools and different data and different way to look at it. So it is just a question, I think, of figuring out a way that's feasible and having the policies to support that, to looking at success differently. Mhm.
sure, sure. So this is so great. We have about 5 minutes left. I just want to advise the audience, right? If there's any questions that are running through your mind, now's a really good time to type them as we look to close out the whole presentation about everything. But just to kind of think largely, right? It's generally a newer idea where judges and attorneys and officers have this curiosity about a system that's outside of them and having these kind of individualized approaches. And so, kind of bringing in that public health perspective. Um, what's some advice or kind of a takeaway from all of our conversation today about recovery capital, social determinants of health, measurements for programs? What do you think judges, attorneys, and officers should know about recovery capital moving forward in the treatment court setting?
Such a great question. It's hard for me to boil that down to one thing. Let me see if I had to try. I guess just to say that, again, I go back to like my starting point of, what I heard from my clients who kept internalizing this idea that they just weren't ready or didn't want it bad enough. And again, I don't think they were coming up with that on their own. I think they were hearing that from other people, people in the treatment system, probably people in the court system as well for many of them. And so I guess I just want all of us to, whether we've struggled, with addiction or recovery personally or not, or know somebody who has, just to try to keep that perspective in mind that this isn't really a question, I think, of wanting it bad enough. And we need to shift that conversation into what can be set up in their lives to facilitate recovery, to make it more possible? And how can, whatever our role is, how can we be part of that? And it's not just about, at the individual level, that's part of it, but ultimately, I think it's about creating systems and communities and cultures and neighborhood resources that make recovery more accessible and more possible for more people.
Yeah, absolutely. I think that's such a beautiful way to relate it to kind of what the collaborative courts are trying to do, right? It's intimidating, it's daunting. I don't think anyone enjoys hearing the
Yeah,
United States versus their name, right? And
right.
it's a reality that people have to look at. But I think collaborative courts kind of bring in this human
Mhm.
component of the justice system where how often does someone get to actually talk to a judge or a prosecutor in the individual level about what kind of coffee did you have today? How was your week been, right? I want to talk through a challenge at work that I'm experiencing. And so when you've only been told that you're incapable of doing something, at some point you start to internalize that, and it's really difficult to change that mindset and behavior. Um, where uh, you are better than that, right? And having someone with a big title, like a judge, saying you can't do that is so impactful. And the research will show that, judicial intervention is one of the key components of interacting with people in treatment courts. But finding ways to kind of look at things, one, at an individual level with people, but having that have a larger systemic impact on how we talk to people throughout the legal process. And so being able to kind of uplift, see where someone is in the community based on their capital levels, based on your assessment, really gives a good guiding point about how to develop intervention, where to focus our time because our resources are limited. And so really just important to kind of think through things, like you said, both individually and at a larger level to see how we can have the change for each person.
Definitely. And I just, on that note, want to add just a small anecdote that I just thought of when we were doing those interviews with a variety of people in recovery to figure out what to include on this measure. I did originally have an item. I think I originally actually had two items about people's encounters with the legal system. And I thought about it, before I did the interviews, I thought, would somebody's encounters with treatment courts or legal system, would that potentially be positive capital, like something that has helped them recover, or would it be negative capital, something that's been a detriment to their recovery? And I honestly didn't know. So I included, I don't remember exactly how I phrased them, but I think, had two items in the pool. And it was really interesting to see how people reacted because, of course, it's such a complex thing and you're only asking a short survey item, and so it gets hard to distinguish between, so like, who had an experience in a collaborative court or a treatment court versus just a non-treatment court, a traditional court. And that's, I think, a huge factor in this, and we didn't ask that level of detail, but it was fascinating to me to hear people's stories, and we really heard both. So we heard people say that absolutely the treatment court saved their life and that was a huge positive recovery capital factor for them. And then we did hear people too that just had very traumatizing and really harrowing experiences in the legal system, and it had been an impediment to recovery. So I say that that's probably stating the obvious, but just to say, I think like most systems, we potentially what we do can go either way. It can affect people's lives in negative ways, but it also can be a huge positive for recovery. And I really appreciate the work you all are doing and what you're doing, Wyatt, and the chance to be a part of that conversation because it's so powerful.
Yeah, no, absolutely. Thank you for that. I think it's a larger kind of interest with systems, right? I mean, went to I went to get, my graduate degree in public health, um, hoping to find some way to relate it to the collaborative courts and found, the healthcare
Yeah,
system and the criminal justice system sure have their similarities.
right.
And there's a hierarchy of positions, right? People are doing lots of interesting things. There's a traditional way to do things. But I think blending those together is really how we're going to have impact both on the people that work in treating these people and the larger outcomes that we're trying to get, right? And so I don't think there is a judge that isn't frustrated with sentencing who wants to find a different way when someone's been
Right.
appearing in front of them for years and years and years. Just like I'm sure a doctor wants to find a way to actually help someone have that behavior change to be healthier or address that diagnosis that they've been avoiding for a long time. So it's really fascinating. And like I said, while the qualitative stories and the anecdotes are really the motivation for how we do things,
Mm.
having that data point and thinking about someone as a whole is just as important. So, really want to thank you again just for kind of sharing all the work that you do. And give just a moment for anyone to type any questions or if they want to jump on to ask a question on Zoom, that's totally okay. But again, thank you so much for sharing all of your knowledge and wisdom about the work that you've done and developing assessment because looking into it is so challenging to find the right steps, especially if you're not kind of if you don't have a data mind, right? It's really difficult to kind of understand the best way to implement an assessment like this.
Yeah, and I know, again, like you said, there's so many tools. People are already being asked to fill out a million surveys. So I'm always like honored if people would consider even adding the MIRC to their battery of assessments because there's already so many other things we're asking people to do.
Mhm.
I did just want to add, because of that ambiguity or the variety of responses I mentioned about those two items on people's involvement with legal systems. We decided ultimately not to include either one, so you will not see either of those items on the MIRC if you look at it. And I wanted to add my email to the chat, or if you save the link that I put in there, there's also like a form on the website. And if you fill that out, it says like you can leave questions and comments here. It goes directly to my email. So I do see those. And so if anyone has follow-up questions or something you think of later about the MIRC or Recovery Capital, I'm happy to chat.
Perfect, perfect. Well, not seeing any questions. So Dr. Bowen, I'm just going to say thank you so very, very much about all of this information. And thank you again for just being available as we look to implement MIRC into our database and our system to measure things in our treatment course moving forward. And we'll be in touch. I want to wish you the very best to close out 2024. And thank you again.
Yeah, you too. Thank you. And thanks everybody for being here. Thanks so much.
Thanks everyone for being here. Have a great Friday.
Take care. Bye.